Back to New Day Northwest. Did you know that more than 500,000 people are impacted by kidney stones every year? They are not fun to deal with, but treatment is out there. Here with some insight is Dr. Jessica Day from Evergreen Health Urology Care. Thank you for being here.
Thank you. Really thank you for having me.
Of course, because when we say they are common, literally my best friend Erica called me yesterday and said, oh my gosh, I got a kidney stone. They're pretty common. Can you give us some insight and background about what they are and how they develop?
Yeah, so kidney stones, as you said, are really common. We're seeing them more and more over time, men, women, even kids.
Yeah, that's crazy.
Yeah. And there's a lot of different causes for them. A lot of them are, common reasons, dehydration, things like that. But there are also associations with other medical problems, high blood pressure, diabetes, and sometimes there's underlying diseases that predispose us to kidney stone risk.
Wow, and so it's important to pay attention and maybe look into what that could be, right?
Absolutely. Sometimes it's just a one and done deal, but sometimes you start forming stones over and over and over again. So
I know that I was with someone once and they had a kidney stone and there was incredible pain. And I know, we'll talk about that in a second, but I know it's not always a precursor. For example, my friend Erica, she's gonna kill me for telling you guys this. She told me that they found blood in her urine during routine testing and they said it was a kidney stone. So what are some other symptoms that can accompany this?
Absolutely. So a lot of times, like your friend Erica's situation, the stones are kind of silent. We pick them up because we notice blood in the urine, or we happen to get a scan for another reason, and those are sometimes stones we can watch or monitor. But other presenting symptoms are often mostly when the stones are starting to move. They're trying to make it out of the ureter, which is the tube that drains the kidney, and they get stuck. And so that causes back pressure in your kidney, pain in the back. Sometimes people feel it in the groin, nausea, vomiting.
Yeah.
And in really severe cases, sometimes can be associated with infections, fevers, chills,
I
burning.
bet. Oh, gosh.
Those can be bad emergencies.
So, again, Erica and I were talking about this, and she goes, why, as a human race, do we not have treatments for this? And I said, aren't there any? And so then, that's why Dr. Day is here today to tell us, are there treatments, or do you have to do it naturally?
Yeah, no, there's definitely treatments, and I have quite a few patients where we go in and we treat the stones before they become a problem, and these are mostly bigger stones.
Okay.
Some smaller stones you can kind of safely watch, but treatment options for stones range the gamut. Thankfully, most of them are minimally invasive, things like shockwave lithotripsy, which is delivering some energy through the back to break the stone up, and then you pass the pieces naturally. Or something called ureteroscopy, where I drive up into the kidney with a little camera. I don't make any incisions, but then I break it up with a laser fiber and break it up into really fine pieces or pull out bigger pieces. And then something for bigger stones is called percutaneous nephrolithotomy, or PCNL, because it's a pretty big mouthful. But that's a procedure where I go through the back and I enter the kidney directly to get the stones treated. So definitely runs the gamut.
So there's things that can be done. Thank goodness. You don't have to go through the pain.
Absolutely.
That's
and it just depends on you, your stone, a couple of other different factors, and so that's where talking to your doctor is really helpful.
Thank goodness for you. So kidney stones can happen repeatedly, right? I mean, it's not just like you get one in your life, you're clear. How can we prevent them in general?
Yeah, and that's huge. Having had one stone event before, you're at risk for having them up to 30 to 50% in the next 5 years. So definitely prevention is key. I give kind of general stone recommendations for everybody. I always tell people, jokingly, numbers 1, 2, and 3, if you're going to do 3 things, are more fluid, more fluid, more fluid. You want to drink at least.
I need some water.
Yeah, you want to drink at least 2.5 to 3 liters of fluid a day, which for most people is way more than we're normally drinking. Other things that are helpful: low salt in the diet, low animal protein, and actually a little bit of calcium. Some people think, oh, I've got a calcium stone, so I got to cut it out completely, and we know that that does increase your stone risk. So about 1,000 to 1,200 milligrams of dairy a day.
Okay, all right, okay. Anything else that people should know about Evergreen Health Urology Care, what you do, how you help?
Yeah, absolutely. We're kind of a full-service urology care. We have, folks specializing in treatment of women, incontinence, urogynecology. We have folks specializing in prostate cancer, kidney cancer, men's health, infertility, and what I do, a lot of robotic surgery cancers and kidney stones, obviously. Definitely a great place for comprehensive urologic care.
That's amazing. So, okay, because that's another conversation my girlfriends and I have after having babies is, don't laugh too hard. You know what I'm saying out there. You know what I'm saying. You help with that too?
Yes, we definitely can. So come on down and see us.
All right. Thank you so much, Dr. Day, and I hope I still have a best friend after this. All right, to learn more about Evergreen Health Urology Care and what Dr. Day and I discussed today, just visit the website on your screen. We'll also have a link on New Day's website. Well, coming up next, we are going to knock your socks off with an incredible incredible 4th of July spread. We're getting ready to party like in 1776 with 425 Magazine's Monica Hart after this.
This portion of New Day Northwest is sponsored by Evergreen Health.